Our next speaker is Dr. Pippa Shulman. She is the Chief Medical Officer of Medically Home, again, another partner of us at World Hospital at Home Congress from the United States. Pippa, please.
Thank you so much, and thank you to the organizers. Itamar, that last sentiment was exactly right. The pace of change has been incredible. I also want to start with a very brief patient story that I think reflects something of what the US is really struggling with, and I suspect colleagues around the world are. An older gentleman in his mid-80s at home having an acute exacerbation of his heart failure. His primary cardiology team has been trying to manage him from home, but they're not familiar with how to provide care in the home space. They're using telemedicine technologies that they've only been using for a week or two since the crisis, and they encourage this gentleman to go to the hospital to receive treatment. The patient refuses over and over and says that he would rather die at home than go into the hospital where he'd been many, many times. And so in fact, his team referred him for hospice services until someone remembered that they had access to good hospital and home services. And we admitted this patient, and I think for any of the folks on the line, this was a relatively uncomplicated patient. And really the reason for this story is how COVID-19 and the response and what's happening in our system, the stressors on the system, has been pushing change and pushing patients and practitioners to behave very, very differently. You know, in January, we had a system that had overly full hospitals, often full with elective procedures. We had relatively low adoption of hospital and home services, often because of payment issues. Our reimbursement structure is crazy, as all of you know, and really poor adoption of telemedical technologies. In the short period of time, all of a sudden, huge swaths of regulation have been changed, where now there's telemedicine parity. And for the first time, we are seeing potential for reimbursement for hospital in the home. And so this is really, I think, when we talk about the catalyst for change, it's certainly not something that we would want or wish on anybody, but it has been quite the reality. Oops, I went too fast. I sped through my own slides, my apologies. These rapid changes in the utilization really shine a light on the legacy large health systems that we have in the US that really have challenges, particularly financially and operationally. And this has been the time to create those changes. As our hospitals empty out, what we've also seen is we are watching the rising, terrifying numbers of COVID patients strain these hospitals. But article after article, colleague after colleague talk about where have our routine patients gone, where have the stroke patients gone, the heart failure patients, the pneumonia patients. They're afraid. And so now there's an increased desire for a need for the hospital and the home partners to step up. And while we at Medically Home, we had a very carefully paced plan for spread, and I saw one of the questions in the chat, now we are being asked to spread at a scale that's unprecedented, and it's frankly surprising, I think, to most of us. There are challenges with that. We're writing policies about something we know relatively little about. We need to think about protecting our supply chain, both from a COVID and a non-COVID perspective. We worry about PPE, of course, staff, equipment, but there is now out there a much wider group of patients and families, and quite frankly, providers looking for care outside of these hospitals. And so one of the unique things that we thought about as we were starting this journey with COVID is we initially said, you know what, we're not going to take care of COVID in the home right away. Now looking back, that seems like folly. There's no way to avoid taking these patients. And so we really need to think about who is safe to be at home and how can we push the boundaries of patients who can safely be accepted. So in addition to taking on patients who historically might have gone to a brick and mortar hospital, we invested a lot of time being able to care for the COVID patients safely at home and know when we needed to have safe and careful escalation criteria, and making sure that all of the folks who are going to the home are able to do it in a safe and effective manner. It's been quite a time, and I've really leaned on all my colleagues for support and guidance. So I thank you very, very much.